ready to get started. We've got a quorum now, and we're ready to begin this meeting. Before we do, I'd like to just have a moment of prayer. Gracious Heavenly Father, we again thank you for another day. We thank you for allowing us to come together to do the work of the state and do what we think is in the best interest of the people of the state of Georgia. And when this meeting's over, please watch over us as we go back to our respective homes. In Jesus' name we pray. Amen. All right, members of the committee, we're going to be looking today at House Bill 398 by Representative Maxwell. And Representative Maxwell, we're ready to hear from you.
Thank you, Mr. Chairman, members of the committee. Appreciate y'all allowing me to come before you this afternoon. We do have House Bill 398. This bill was brought about because of some circumstances that happened a couple of years ago. Back in 2011, passed Senate Bill 178 that created a new level of licensed residences called assisted living communities. That was a way to further allow people more options to age in place, I guess it's called. Some places that I'm afraid I'll be looking for one of these days. But Department of Community Health, after passage, they came out with the rules and picked up a little section of 178 that said the term assisted living could only be used by the residences licensed in a new category, something that was created by us in 2011. I don't believe, and other folks don't believe, that was actually intent of Senate Bill 178 to come up with this category and then to prohibit people that have been using the term assisted living for years in their businesses to not be allowed to do so in the future. House Bill 398 makes a little change to correct this problem. It does not change the substance of current law that was passed under Senate Bill 178. There was a Senate bill introduced last year. It was not considered and not passed since the DCH had not formed their rules and regulations at that time. But after the fact, now we've come down to a situation where there's about 1,500 personal care homes that have the term assisted living in their title that are going to be forced to do one of two options. They're going to have to apply as a new assisted living home under the new guidelines and regulations, or they're going to be prohibited from using the name assisted living in their marketing materials and the names, the signage and everything they have out front now. I know several people, I've got friends of mine that have run these businesses, some of them since 1988, that have 32-bed assisted living, assisted care, personal care homes that have had assisted living in their title. That's going to be quite a unintended consequence, I think, to force over 1,500 people, businesses, to go back and change their names because of a regulation that we came up with last year. So what we're attempting to do in this bill is to allow these people on lines 23 through 29, saying they can still use the term assisted living, will not prohibit a licensed personal care home or community living arrangement from using the term assisted living or some other phrase containing the term assisted living in describing their services, provided, however, that no place of the living facility or other entity shall use the term assisted living care or assisted living community unless they are licensed under this new, I guess, category that was signed or came up with in House Bill 179. So that's basically what we're doing. We're trying to protect these companies that have been doing business in the state of Georgia, try to protect their business, their integrity of what they're doing. There's a lot of people here who want to testify, so that's basically the summation of the bill, Mr. Chairman. I'll try to answer questions, or I can come back later. I know there's a lot of people who want to testify on this.
Okay. Do I have any questions from members of the committee right now? All right.
Could you, good afternoon, Representative Sandra Scott. Could you give me the difference between the assisted living homes and the personal care homes? Is it a difference?
Not a very large one, ma'am. Both of them basically take care of the same type folks. I'm going to let one of the experts come up here and give that if it'll be all right.
Oh, okay.
We've got some people that can give you that, I'm sure, more than you ever want to know, probably.
Oh, okay.
Any other questions of Chairman Maxwell before we get into people coming up and testifying? All right, thank you.
Thanks, sir.
We had a sign-up sheet over there on the table. Is there anyone that wanted to sign up to speak that did not sign up? I'll put you down. Okay. I'm just looking at names. Since I quit teaching, I'm getting where I can't read people's handwriting. Is this Teasley Martin? How about Allison Holt? Okay, all right, that's fine. All right. Michelle Miner. You would tell us who you are and who you represent?
Yes, sir. Thank you. My name is Michelle Miner. I'm representing Sunrise Senior Living, and I'm also the chair of Georgia Alpha. I want to thank you for the opportunity to speak today, and I certainly had some preparations, but I wanted to answer from our perspective the question that was asked from the representative. And there is a very large difference between assisted living communities and personal care homes. One of the main differences is that we will have licensed CMA, certified medication assistants, that will be under the supervision of the state of Georgia, of the Department of Community Health, that will be able to administer medications in our communities. So they are CNA, certified nursing assistants, and they are CMAs. The other part that we're going to be able to do as an assisted living community is that we have to be licensed as a limited health care occupancy. And that way we are able to provide care for seniors who are frailer without having to apply for waivers. So those are some of the bigger distinctions. And we have to provide additional training for individuals in assisted living community. So over the years as senior advocates, we fought to allow seniors in Georgia to provide aging-in-place options for seniors in personal care homes for organizations that were willing to take the additional responsibilities, including additional staffing and training. Georgia Alpha represents groups that are applying for the new licensure and some that are choosing to remain as personal care homes. As a result, we worked with the Nursing Home Association, AARP, COAGE, and several other senior advocacy groups and legislators to allow seniors in Georgia the choice in care and options to age in place. Today, I urge you please to vote no on Senate Bill 398 and help allow the public to have clear language of what assisted living care can and cannot provide. To allow personal care homes to use the language assisted living confuses the public regarding what the new category of assisted living can provide in regards to a range of expanded aging-in-place services. I'm sure that you wouldn't want a hospital to call an outpatient clinic to be able to advertise that they are a hospital. Likewise, if you are licensed to care for more fragile and involved seniors in an assisted living than a personal care home, why would you want to mislead the public on the services a personal care home is licensed to provide? The battle to get aging in place took a very long time for all of us, so please don't water it down by allowing the free use of assisted living by entities which were not licensed to provide the services. Those providers who work to become licensed as an assisted living community, and for those of us that are spending a lot of money to ensure our communities are in compliance, thank you in advance, and thank you today for your time and consideration.
I have a question. Would you tell me again the difference between a personal care home and an assisted living home?
Sure. There's one of those is that you have to have a different
Which
certificate
one?
of occupancy. The assisted living community has to have a limited health care occupancy.
Okay.
So we have to have the right sprinklers so that we're providing. Oh, okay. And then the personal care homes do not. We have to have licensed oversight in an assisted living community for medications, which is our certified medication assistants, and that's in assisted living communities. Personal care homes have non-licensed individuals that are able to pass medications. They can help administer those through a proxy, but that has to be monitored by an RN. So those are two of the main differences.
Is there any difference in the size?
Yes, sir. You have to be, in order to be an assisted living community, you have to be 25 beds or more.
So somebody that has 6, they would be a personal care home according to the new definitions.
Yes, sir.
So that would be really 1 to 24 would be a personal care home, and assisted living would be 25 to what? Any number?
Any number. And you just have to have 25 beds or more to apply to be an assisted living.
All right. Would you tell us the difference between an assisted living and a nursing home?
The difference between assisted living and a nursing home is that the nursing homes provide skilled care.
Okay. So the difference being is limited health care to skilled health care.
The licensure for the state fire marshal is the limited health care
Mhm.
occupancy. But the care level is that we provide health maintenance activities, and then in a skilled nursing facility, you're going to provide skilled care.
So if the assisted living caught on fire, would they be able to assist them out?
Yes, sir.
Okay. All right. We have a question for number 10, from number 10.
Thank you, Mr. Chair. Thank you so much for being here. The number 25, is that just an arbitrary number? How was that particular number
That number was
chosen?
come up with the agency and a lot of different groups that came up with that during the rule right process, or the legislation, actually.
14.
Thank you, ma'am. Just looking on this bill on line 27, it uses those terms assisted living care and assisted living community. What's the difference in those?
Assisted living community is the community itself, and the assisted living care would be the care that you provide, and you're assisting someone to provide care in an assisted living community.
Okay.
Any other questions for this, Ms. Whitney? Thank you, ma'am.
Thank you.
Oh, okay.
Thank you so much. How many assisted living communities do we have in Georgia?
Right now we have 6.
6.
And we're working with the state fire marshal to do waivers of some of the communities that were not able to apply under the current regulation from the fire marshal's perspective.
Mm-hmm. And then how many personal care, or is that a question for someone else? Okay, I thought 2203. Thank you.
Thanks.
Thank you. Melanie Hendricks.
Good afternoon. My name is Melanie Hendricks, and I'm here representing Emeritus Senior Living. And I, too, want to ask you to please vote no on the House Bill 398 and help allow the public a clear understanding of the spectrum of services allowed for seniors, specifically what assisted living can and cannot do. Representative Scott, you asked the distinction between the two, and it's evident that there's not a clear distinction right now. That's what we want to have for the consumer, that clear distinction, where one, the use of the assisted living terminology would apply specific to the assisted living licensed communities. It would help clear up the confusion on that. We are seeing the same thing in other states within our company, where specific levels of care are being identified. Assisted living being the higher level of care that's provided, the personal care homes the lower level of care that's able to be provided. Just an analogy, kind of makes it more clear in my head, is if I have the qualifications of a nurse, whether it's an LPN or an RN, I'm called a nurse. But if I was an LPN, in order to be titled an RN, I would have to meet certain specific higher qualifications. So we think the same thing about this distinguishment between assisted living communities and personal care homes. So I ask you to please oppose the House bill.
Anyone have any questions for this witness? Okay, thank you. Stephen Neff.
Mr. Chairman, members of the committee, my name is Stephen Neff. I'm here actually representing two groups, the Assisted Living Association of Georgia and the Georgia Association of Community Care Providers. We represent personal care home assisted living facilities along with different other kinds of providers. We're here to ask you to support House Bill 398. And quite honestly, what happened here, with the discussions with the previous two presenters is all of us as groups met to after 16 years we worked on this legislation. We put it together, the assisted living groups as well as the nursing homes with our peers who we worked with for many years, and we had decided on some numbers. We decided on the 25 beds, and the basis for that is because that's the cutoff for Medicaid, which means that therefore all the beds above that would be private pay and it wouldn't affect anyone in the Medicaid stream. Only Medicaid that can be received by those that are under 25 is for the CCFP program and those waiver programs. So that's the reason that number was decided. But we all made an agreement on Senate Bill 178, and then as we have discussed, within the boilerplate parts of this bill down was the Fair Business Practice Act, which was where this language was put in, just as you're updating all of the language. It was not agreed upon, not talked about in the committee or anyone. And assisted living as a term is the term used in 40 other states as the generic term for what is the services that all of us provide, which is assisted living, activities of daily living, bathing, toileting. And our providers, whether they're 6 beds, like Mr. Chairman asked, or whether they are 24, or whether the next presenter just happens to be 44 beds, who's over the 25, but is not interested this time in becoming an assisted living community or going for that licensure. So they would have to, they would want to be able to use the term assisted living as a general term as well. I try to make kind of a silly argument with it, as I have with other folks, and then to me it would be like the Kleenex Corporation saying that they own the term tissue and nobody else could use the term tissue as the general term, or that Coke owns the term soda and nobody else could use that term. Assisted living is a general term that's used by the public to identify the services all of us provide up into a nursing home. And that would, to me, it's a very common sense argument. I do understand my peers that feel like there should be assisted living communities should be defined differently because it's confusing for consumers. I think it's confusing for consumers opposite, meaning that they all use the term assisted living. When they walk in one of my providers' establishments, their facilities, and they ask if they provide assisted living services, or if they discuss, they look at their paperwork. Well, of course, that's the services they provide. And so that's why we would ask you to vote for House Bill 398, and I'd be willing to take any questions. I was glad of the question as well about the number of assisted living communities as defined now, because the fire code is so much stricter. As those homes are trying to get to there's only 6. So in essence, out of 2,200, all of the other folks can in essence not use the term assisted living, while 6 homes would be able to. Seems kind of interesting perspective to me.
Okay. Number 11.
Oh, okay. I'm sorry.
Yes, ma'am.
So, is it different levels of care that is given in the assisted living and from the personal care home? Is it one thing that they could do in assisted living that cannot be done in the personal care homes? Is it a difference in the level of care or what could be given to the patients?
Yes, ma'am, Representative. The issues that were mentioned before, I do agree with. I, however, also feel that, with regards to what assisted living, personal care home has always been as the terms in this state, used as the services we provide. With Senate Bill 178, we actually made very minuscule adjustments as to what more someone could actually do in assisted living community. I have several providers within my Assisted Living Association of Georgia that have come to the fire marshal. The fire marshals come out to them, I should say, done their assessments. Their construction costs are going to be like $200,000 to add R13 sprinklers, and they can't justify the fact that for that little bit of services, adding a CMA when they could use certified medication, when they could use a proxy caregiver. as to why in the world they spend $200,000 to update their facility, which was money that they're not going to be able to really improve their services that much, would be their opinion. And I'm afraid, I'm disappointed that gentleman couldn't be here today, but he's just one of several that is waiting to see if the fire codes were to be changed to make it easier for these facilities to not have R13 and not not do those sprinklers that they might move forward with getting assisted living community licensure, but at this point, certainly not. Does that answer your question? Yes, ma'am.
Number 14.
So give me over here.
Yes, sir.
It's a little history lesson. You brought it up, so now I want to ask on, when you did 178, you mentioned that within the senior health community, there was an agreement. And I'd like for you to talk about that agreement.
Yes.
I think that's really at the bottom line of it. And,
Okay.
uh-oh. Sorry about that. But
See if I can answer it.
that agreement and
Yes.
how, I think the other people who are going to talk
Yes.
also could talk about it.
Well, in essence, when Senate Bill 178 was originally drafted, the larger homes met with the nursing homes and drafted some legislation to determine certain issues. Definitely the 25 beds, certainly because that avoids the Medicaid. Just makes it for the private pay folks, and that after 16 years, that clearly was an agreement that could be agreed upon by working with various leadership. As we went through the process, that was something that our folks certainly agreed with, and we're happy to move forward with that piece, with the idea that we'd come back to the legislature in several years, see how this assisted living community was working, and then we'd move it down into the that would have been would have been our hopes to move it down into the under 25s, into the Medicaid community. But at that point, for Senate Bill 178, we all certainly agreed not to that would just be for the over 25s. We also agreed on numerous parts of the legislation. We worked with Chairman Sharon Cooper most diligently, Chairman Renee Unterman, and as we worked through the process, there was one thing that was very clear, in my opinion, which was as you develop this new assisted living community through Senate Bill 178, that there would be no changes made to those personal care homes that were being affected now, those that were running their businesses now. And in essence, that's what we feel that this interpretation from the Department of Community Health does, and that in essence it affects those that are providing their business now that have no plans to become assisted living community. They always use the term assisted living as a general term. When personal care home was developed, and I'll try to be brief, there's a lot of other speakers, but when it was developed many years ago, the term assisted living really wasn't being used that much. That's why personal care home licensure was developed as it was. And, you all can remember back when we just had retirement homes and group homes, and folks took aging folks. Well, that was long before there was a true terminology really used for assisted living, hence why the personal care home licensure is what it is today. It's just been what it was determined after all of it. Does that help you out?
Yes, sir.
Yes, sir. Thank you.
I've got a question.
Yes,
Was there
sir.
any
Sure.
talk in the original legislation to grandfather people in as far as what they would be called?
There was not, but mostly because this was not an issue that was on the table for discussion.
Okay.
We all agreed to the legislation as it was. We all went in front of committees just like we're going in front of now. We all worked as our peers as what we thought was a good bill. And and then as I look back now, I can wonder why it was we didn't discuss that, and that's just because it wasn't an issue. There was not supposed to be any changes, an issue. Wasn't supposed to be any changes made to the smaller homes that I represent. We were all supposed to be able to just go about our business, and was mentioned in community numerous times to that effect. I personally believe it was unintended consequence. I don't believe the legislature intended this language to be in the Fair Business Practice Act of the boilerplates down in there. I do believe the Department of Community Health, who we also are proud to have the opportunity to work with, but I believe that they determined that this section did that. I believe that you all did not intend that to be.
Okay. All right. Thank you. Any other questions for this gentleman? All right. Thank you.
Thank you for your time.
Dan Day.
Thank you, Mr. Chairman, and thank you, committee, for allowing me the opportunity to share with you some of my thoughts on this House Bill 398. I appreciate the opportunity and appreciate your consideration. My name is Dan Day. I am the owner of Gaines Park, which is a community, a 44-bed community in Kennesaw. I developed it 16 years ago. I operate it day to day, and have been very involved really in the process of both this legislation and pretty involved with the department when it comes to writing rules. And so I feel like in my thoughts here today that it's not really a question of really keeping it in your name. I mean, I've been called Gaines Park Assisted Living for 16 years. And everybody understands what that is. There is an understanding that there's a group of services under assisted living that encompasses a certain spectrum of non-independent, non-skilled care services. This legislation that has been presented, utilizing the word assisted living to define the services in a clear way for the consumer, doesn't get the job done. I have several phone calls a week. Someone will call in, I'm looking for a place for my wife, she's going to be coming out of rehab soon. Are you in assisted living? I paused, at least here recently I paused, because it's been, since these regulations have taken effect January the 8th, many of us have been scrambling, trying to rewrite our policies and rewrite all our procedures, because the department is already out doing inspections, even after announcing it January the 8th, that they were effective January the 8th, which I actually had a problem with that as a provider. So I've been addressing that part of the issue because I don't want the surveyor to be walking in and he not be compliant with the new regs. When someone tells me they're looking for an independent community, I understand what that means. When someone calls and says they're looking for an assisted living, they understand what they're saying. I understand what they mean. When they call and say, my mom needs a nursing home, and while the term nursing home has been kind of shuffled out of the picture over the last years, namely even the association has changed their name to Georgia Healthcare, because nursing home now means several different things. There's skilled care in that, there's rehab care, there's rehabilitation, there's everything but what we call nursing home. But the consumer understands what takes place in nursing home, it's skilled care services. In assisted living, there is a group of services that provides assistance with activity of daily living. And we all do that. It doesn't matter if you're a personal care home or assisted living community. You provide assistance with activities of daily living. The differences that take place with this new licensure is, in my case, it's a single-level building. I probably could easily get the new licensure level. I already have a fully sprinkled building. There's one section that's a 13R, but there's a possibility that may even qualify to meet the new limited health care life safety code. That's being considered and part of the discussion. So I could actually qualify. The question I've got to ask is, though, is it going to make enough difference in the services that I provide to make that change? And right now, I am doing the same thing I have been doing for the last 16 years. I've structured my care plan and my care based on proxy caregiving, which they oversee certain aspects of health care maintenance, and I won't get into the weeds of that, but a proxy caregiver is utilized to provide services with health maintenance activities. I won't try to define that, but that does compensate for any additional care that where in the past I've been able to do. Now I do it under a proxy caregiver. As I mentioned, I've already received a couple of phone calls, and gentlemen asked me, "Are you in assisted living?" And like I said, I paused. And this is where I want to explain where I'm the one teaching the consumer what they're looking for. Because he called and asked, and when he asked me if I was assisted living, knowing that I haven't gotten the new licensure level yet, if I answer yes, I am assisted living, then am I in violation of the new regs under the new licensure level? And I'll say, no, I'm a personal care home. Well, what's the difference between personal care home and assisted living? My opinion is very minimal. Now, I realize there's some opinions in this room that will vary to that. And I could go to the new CMA, Certified Medication Aid, and go through that whole program and protocol where I can use proxy caregivers. I can still serve the group that I'm serving now. Okay, so I can get that change. So I began to explain to him the difference between personal care home, what proxy caregiver is, what a CMA is, and what an assisted living community is. So there is no clear distinction when I use the word assisted living when someone calls and asks me that question. I recently received my notice of renewal from a magazine called New Lifestyles. There's a heading in New Lifestyles that's called assisted living. They have 6 beds, they have 12 beds, they have 44 beds, they have 120 beds. Okay, so I sent a note back and I asked her, I said, are you aware that the law has changed in Georgia that you're going to have to change your magazine for this consumer magazine where we may not be able to list under assisted living. At that time, I didn't know how many had gotten new licensure, but I said it's a very small number right now, and it's going to affect you when this new issue comes out. So that was already a consumer issue that's going to have to be addressed with just how we use the term. So that, and also the discussion as far as small homes, there was a good bit of discussion on the writing of this Senate Bill 178, and I was a part of that discussion originally. The doors were actually closed on me when it got to that point of making some final calls on it. The small homes weren't necessarily represented very well in that discussion, and I think and what happens is it's going to prohibit them, anyone with 24 beds and less, to be able to get this assisted living licensure unless there's a new law put into place that changes how small homes are going to be able to operate. And not all cities in this state can accommodate a 100-bed assisted living or a 100-bed health care community. They just can't sustain. So you're going to have small homes somewhere throughout the state. And so somehow, they're going to have to change the services, or be able to provide services that meet the needs of that community. The word assisted living is strictly a consumer understanding that there's a group of services that are provided that are non-independent and that are non-skilled care. And most consumers understand that. I have been defining that even for the past 16 years when they ask about assisted living. Ask me what I do. I still tell them what I do. Because even as providers, we provide different service levels even within our community. And all that's been put in place by the original regs because we could actually define the amount of care we could serve. We could define who the residents would be. And so even up until this point, there was some flexibility on what you call assisted living care, assisted living services. So my point is, the use of the word assisted living does not clarify any more for the consumer of what they're looking for out there. So we can debate the issue on whether or not it separates services all day long. But the consumer, unless they're very knowledgeable and more knowledgeable than we are, they're still going to call everything assisted living. So we're going to deal with that even moving forward. Thank you.
All right, we have a question, number 6.
So I'm taking it that it should be the responsibility of the market to define assisted living and not an agency. Is that what I'm hearing from you?
The market is always going to demand what it needs, and that's really how the current assisted living services have evolved. Because not everybody qualifies for skilled care; they can't take care of themselves; they're independent, and so there's already a market that was created, beginning probably small and then getting larger as this population ages. And we're only getting bigger. That group's only getting bigger.
Thank you.
Mm-hmm.
Any other questions for this gentleman? Okay, number 10.
Thank you, Mr. Chair. Thank you so much for being here. So I'm going back and looking at SB 178, and as I'm going through this particular bill, I specifically see that it is stated they're stated independently of each other, and the things that are being stated independently of each other are assisted living community, personal care homes. So I guess some of my concern is if they're delineated by two different terms, and if that was not the intention of the bill, if these conversations were taking place, why did that not come up in that particular bill, or did it come up in that particular bill? Because it clearly states assisted living communities, personal care homes, and it states that throughout the bill on several different pages. Does my question make sense to you?
It does.
Okay.
Okay.
Okay, I can wait. I can wait. He's better suited for that.
Okay.
Oh, okay. Go ahead.
Well, I don't want to be redundant, but I guess as far as the use of the term assisted living community versus personal care home, in the bill, I guess that was to distinguish the discussion of of some of the services. Just like it says assisted living care is defined as all these personal care services plus the use of the CMA. See, that doesn't mention, I don't think, I'd have to look at it again, if that mentions certain building requirements, which meets the life safety code, has already been mentioned, unlimited health care, life safety code.
Okay, thank you, sir.
All right, thank you.
Melanie McNeil.
Thank you, Mr. Chairman and members of the committee. I'm Melanie McNeil. I'm the State Long-Term Care Ombudsman. I'm not a provider. I oversee the program that's authorized by the Federal Older Americans Act and state law to advocate on behalf of residents of skilled nursing facilities, personal care homes, assisted living communities, intermediate care facilities for the mentally retarded, and community living arrangements. So I'm not here to say you should vote for or against, but what I do want to raise is what I hear from the local ombudsman is that residents in personal care homes and their families are confused already about what's personal care versus assisted living. So this bill, it seems like a very simple bill. Just say you can use assisted living, but you can't say assisted living care. But that, to me, just continues the confusion for consumers. I think it's important that there are clear distinctions so that people understand. For example, if you want to be a resident in an assisted living community, you can be admitted if you can assist with self-preservation. But in a personal care home, there are more restrictions about what your abilities are when you enter a facility and whether they can keep you or not. So you might enter a facility in a personal care home and be totally able to get out of the facility. You're able to ambulate, no problem. But over time, you lose that ability. That personal care home may be able to continue to keep you in that facility, but they have to get a waiver to do it. But in the assisted living communities, there are different rules around that so that people know going in, okay, I'm going to assisted living community, I'm maybe more likely to be able to stay here because I'm not going to have to get a waiver. So, I mean, there are some differences. I think it's important that as you're making the policy decisions, you just weigh, as a consumer, as I'm looking to put my family member in a personal care home, assisted living community, skilled nursing facility, I think it's important that you really clearly know, what am I getting into? And before we had the assisted living community law, we had personal care homes and we had skilled nursing facilities. You had one or the other. Now we have this in between. So it probably didn't matter so much if you were a personal care home, but you said I'm assisted living because there wasn't anything else. Well, now there is. So I just think it's important that we're careful about how we describe what's a personal care home, what's assisted living, what's skilled nursing, so that people really can make an informed decision about what they're getting into and what they can expect.
All right. Anyone have any questions for Ms. McNeil? Okay. Continue.
Thank you, Mr. Chair. You mentioned the waiver. Would you be able to answer a question for me that deals with how long it takes to get a waiver? So like the scenario you mentioned, you're already in the personal care home, your health needs change at some particular point, you have to apply for a waiver in order to be able to get that type of health care. Is there a length of time that it takes to get a waiver?
You know, there probably is. The way it happens, the facility applies for the waiver for you.
Right.
And my understanding is that, you know, the family works with the facility to apply for the waiver, and they're not like told, okay, you have to get out until we get the waiver. But someone from the Department of Community Health could probably answer that a little bit better. I don't really know,
okay,
no
problem.
how that process works.
Okay.
Yes.
Any other questions? Thank you very much. Skin Edge.
Thank you, Mr. Chairman, members of the committee. I'm Skin Edge here on behalf of Georgia Alpha. And we are here in opposition to House Bill 398. Would ask that you vote against that bill. I want to make it clear, first of all, that Georgia Alpha represents both personal care homes and assisted living communities. So we represent both of these. And just to respond to some of the points that have been made already here today, because I think they're right on point. Representative Scott, you mentioned, are there differences between the two? Absolutely there are differences. The way I boil it down, not being an expert like some of the other folks, but the difference is medication, ambulation, training, staff levels. There are clear distinctions between personal care homes and assisted living communities. And the legislature a couple of years ago recognized that when it created those three levels: nursing homes, assisted living communities, and personal care homes. They set that into law. This is not something where in years past people used the terms personal care and assisted living interchangeably. The legislature set this law up so that you have three distinct classes, and there are differences, very, very important differences. And we think that is very important. Representative Jaspers, you asked the question about the history of this and the intent. I think if you look on page 1 of the bill that has the language from Senate Bill 178 from a couple of years ago, if you look, I think it'll give you a pretty good insight into that. On line 15, 16, 17, it says any personal care home or any assisted living community it's unlawful for them to offer, advertise, or solicit, and go down to provide services down in double I for which it has not been specifically authorized. The bill 2 years ago specifically said if you're not authorized to provide these services, you can't advertise for those services. And what we've got here in this bill is we've got a group of homes, personal care homes, who are not authorized, i.e. licensed to operate as assisted living communities, yet they want to be able to advertise as assisted living communities. But the language, the ombudsman spoke just a moment ago, and I think she made an excellent point. The question is the public going to be confused or not? The language in the bill, it says you can use the term assisted living, but you can't use the word assisted living care. Now, does that really, when you think about it, does that make sense, or is that going to be confusing? I mean, how do you draw that line? And we think it is going to be confusing to the public. We think that the purpose, one of the purposes behind Senate Bill 178 was to give the public very clear information about the different levels of care and different levels of services that are available in the state of Georgia, and to allow one type of facility to advertise and use the term assisted living when it's not licensed as an assisted living community. Just frankly doesn't make sense. It doesn't make sense. It'd be like me being a sports therapist or a licensed physical therapist, advertising myself as an orthopedist. I don't have that level of training. I don't have that level of skill. I haven't been to school, that sort of thing. And here, the situation, we think the analogy is basically the same. You shouldn't be allowed to use in advertising something that you're not licensed at. It'll be confusing to the public, and frankly, that's something that 178 was trying to avoid. The representative, I think he had to step out a moment ago, made the point about the market, and then the market sort of sort these things out. The market will sort things out if it's provided clear information. And we think this bill, as it's drafted, will confuse the public, not provide clarity, but more confusion, and the market will not work as it should. If the public's provided good information and saying, okay, nursing home, assisted living, personal care, then they can make intelligent decisions about what level of care their loved ones need and should take advantage of. And we think that's the point behind these bills. So we understand the points that were raised by Representative Maxwell. But frankly, again, if you look at the existing language, going back to what was passed 2 years ago, not what's being changed in this bill, the existing language, we think it was pretty clear then that you weren't going to be able to advertise yourself as an assisted living if you weren't. It says it right there on line 17 and line 20. And to change that now, not even 2 years after that law went into effect, and totally turn that upside down, we don't think it's going to be in the short-term interest, frankly, of the consumers of Georgia or the long-term interest. With that, Mr. Chairman, I'll stop. Any questions?
Right. Anyone have any questions of Mr. Edge? All right. Thank you, sir.
Thank you.
Walter Coffin.
Walter Coffey, and I'm CEO of Leading Age Georgia and the Center for Positive Aging. Leading Age Georgia has been around 40 years, and we represent predominantly nonprofit providers of all kinds of housing and community-based service providers. About 170 providers that serve about 127,000 older Georgians each year. And we would like to ask you to support this bill and move it forward, because for the same reasons that we think that if we don't have this piece of legislation, that it's going to confuse consumers. We have personal care home members that we call assisted living members that are going to be licensed as assisted living communities that have over 25 beds currently, and that will go ahead and have certified med aides and choose that level of care. We also have larger personal care homes that have over 25 beds that are going to choose to maintain their personal care home license, because they may be in a continuing care retirement community where they already have a nursing home and that's working smoothly for them, or they may want to not get into having medication administration and the laws that are tied with the issues with the fire marshal. We have some members that would like to be in assisted living under this new legislation, but because they have older buildings, they don't have the ability to do that, and it would cost several $100,000 to prepare their buildings to do that, so they're choosing not to. Also, one of the things I like to say is that under our organization we have a consumer center called the Center for Positive Aging. And one of the things that we've tried to do with our center is to help inform and educate consumers and help them navigate the maze of aging services that we all find ourselves in, because things are getting blurred, and there's many ways for elder care to be provided through home care agencies, home health agencies, just many different ways for that to happen. And we are concerned from a consumer point of view, because most states, I think it's 40-something states, describe a basic set of services as assisted living. And those services are 24-hour watchful oversight, assistance with activities of daily living like bathing, dressing, meals, housekeeping, some kind of medication oversight. It may just be paying attention to it. Some residents may be able to manage their own medication. Some may need assistance. So there's a basic, like Mr. Day and Mr. Neff were saying, there's a basic understanding in the consumer world of what assisted living is. And thinking that we have 2,200 personal care homes, I think it's 1,934, 88% of those licensed personal care homes aren't even eligible, meaning that they have less than 25 beds, aren't even eligible to be licensed. And so that leaves 269 providers that are eligible. So far we have 6 in 2 years. We may get 50, we may get 60, but all of those ones that are eligible are not going to choose to be in an assisted living community, because they are not wanting to administer medications. They aren't wanting to have the fire marshal's higher standards for different reasons about their policies and the way they choose to operate. So what we're concerned about, say, we get 30, and a consumer moves to Georgia looking for assisted living. Well, there's 30 choices in the state of Georgia. It just doesn't make sense. And so then we're going to have 2,100, 2,000, however many personal care homes that are still offering these basic services that consumers understand as assisted living, and that we have called assisted living in Georgia, forever, that is going to be really confusing. So, we would like to get this cleared up, because we understand that the legislation, and we all agreed, everybody says they were at the table with whoever. We were all down here in corners working and talking to legislators and being a part of different meetings to work on this, and everybody agrees that there's a gap between personal care homes and skilled nursing care, and that this was an opportunity to kind of fill that gap. Now, ultimately, one day we probably need to go back and get official levels of assisted living to clear it up, and that's a dialogue for another day. But the idea is, in the meantime, under the assisted living umbrella, there should be personal care homes and assisted living communities, because there are those basic core services. The main differences are the administration of medications, which has always been a problem in personal care homes for residents that are more confused or that are on a lot of medications. Sometimes they need those administered. So the new assisted living level allows for, or actually calls for, certified med aides that are really focused on being able to provide that skill. But even in personal care homes, even before this legislation, when we had 2,200 personal care homes out there doing assisted living, there's a variety of ways that those services are provided in different settings. And the state requires that you have policies and procedures to tell what you're going to do, what you're going to offer, and how it's going to happen. A really good example are residents maybe that have been diagnosed with Alzheimer's or have some form of dementia. So maybe it's in a personal care home says, we aren't equipped to do that. And a part of our policy is that, we can't provide the care that you need if you are exhibiting signs of dementia or you have a diagnosis. Where some personal care homes say, yes, we're going to do that. We're going to meet the standards and offer that care. So even in personal care homes, there's a variety of sizes. There's a variety of ways that they choose to operate. The state, to clarify this, the state is also developing, the Department of Community Health is developing a form where you have to explain to consumers what you're offering. So whether you're a personal care home or a assisted living community, you still have to say, yes, we do this, yes, we do this. No, we're not going to do this. And they allow providers to figure out what it is they want to do and how they want to do it. So it's been interesting that we have the same reason for wanting it and not wanting it, is the confusion for consumers. But I can tell you now that we have this center that people don't know. I mean, your average consumer, they think they're looking for assisted living. They understand, like it's been stated, there's independent living ideas, there's assisted living, and there's nursing homes. And your basic consumer, understands that. And in my opinion, I've been working in this field for a long time, over 20 years, and my areas I've actually opened and developed and gotten licensed 3 personal care homes over the last 18 years before I moved into this position. And there's a basic core of services, and there's a basic term that we use as assisted living. So when we were developing Senate Bill 178, the bill says that the term assisted living community and assisted living care only can be used by assisted living communities, and we were all right with that. We never had a discussion about the term assisted living not being able to be used, and we never thought about it because it wasn't an issue, like Mr. Neff said. So once it got to the regulatory side, and many of us in this room were on the rules committee, and we started saying, now, if personal care homes can't use the term assisted living, that's going to really be confusing, and it got put on a parking lot list for later. And so we knew that it was going to turn out to probably be confusing. So we feel like that personal care homes should be able to say, to describe their services that they provide as assisted living. We won't let them touch assisted living community, assisted living care, because the law states that, and we all agreed on that. So we would like for you to consider moving this forward and let us continue the dialogue, at least just to clear this up. And then later in the future, maybe we can talk about how to clean it up really well, and under assisted living have maybe level 1 and level 2, like the state health planning agency actually suggested back in the early 90s.
Okay, thank you. Anyone have a question for the gentleman? All right, thank you.
Thanks.
Tom Bauer.
Thank you, Mr. Chairman, members of the committee. This has been a long hearing, and I appreciate it. It's a very important question. I will try to be brief, and I just want to make a few points. I'm with Leading Age Georgia, also a different wing from what Mr. Coffey was speaking from. I wanted to give you a couple of visual aids. He talked about the states that use assisted living Last year when we tried to get this moving, but the DCH had not come forward with the ruling yet, so we didn't get any traction. I put together a graph, a chart, 40 states license facilities, residences using the term assisted living, using the same or very similar services to what our personal care homes do. That's the 24-hour oversight, the assistance with activities of daily living like bathing, grooming, feeding, etc. So when the consumer looks, they are looking for assisted living like they are in 40 states. Mr. Chairman, you asked about the grandfathering, and I think Steve did a good job of answering it to you, but I want to do a visual here as well. And yes, we did create a new level of care, and as those of you who have been around here, and probably the freshmen as well know, the new language is this underlined language. That's what the attention got concentrated on. The bulk of this bill is the boilerplate plugging in that new term, assisted living community. Now, I don't want to muddy the waters too much, but there were some questions over here about the waiver process. When this bill was originally introduced, I guess it was, well, the new I think it was as it was introduced, but it had 25-bed limit, but it also said that personal care homes could not go through that waiver process. And it was buried back in the boilerplate portions as well. Had that provision stayed in, no waivers, that means that the personal care homes, and Melanie is right, people get admitted and then they need to age in place and they need a little more help. Had that not been allowed to continue those waivers, then those folks would have had to have been kicked out and move up to the 25-bed home. And let me tell you, the 25-bed homes are going to be the expensive homes, and everybody cannot necessarily afford that. So I was one of the ones who went to Chairman Cooper and I said, Madam Chairman, this is going to be a significant public policy problem. You're going to have people with nowhere to go because they're not going to be afforded. And she said, draw me up some language that puts the waivers back in. And so we did negotiate that with GHCA. And they went back in, and there were many members on the committee. Representative Clark was on the committee for that discussion, same thing in the Senate. And there were many representatives and senators who said, I want to make sure that the personal care homes in my district can keep doing what they are doing. And we said, yes, if you pass this amendment to put the waivers back in, they can. Then DCH came along, as Mr. Maxwell pointed out, and a year later in the rules took the boilerplate language and that language about the Fair Business Practice Act and said nobody can use the term assisted living except for these new communities, of which there are 6 right now, 6 out of 2,000 options. Very small choice. Well, it makes no sense for y'all to think that that was what the legislative intent, with all due respect to Mr. Edge, because it was in the boilerplate part. Why would so many legislators say, I want my personal care homes to keep doing what they were doing, and then you turn around and say, well, but they can't say that. They can't advertise it and keep saying they were providing assisted living. So those are 2 of the main points I did want to bring up. I did also want to address Mr. Edge said one of the speakers said that we were trying to water this down. No, this is a very conservative approach. We've made it very clear from the first, all that we want is for the consumers to understand and be able to look for assisted living services, which are the services that personal care homes provide. We're not trying to change the scope. We're not trying to change the 25 beds. We're not trying to change the Medicaid age, any of that. And to address Mr. Edge's point, looking at the new bill, and he was citing that boilerplate language, but we're not trying to get licensed as assisted living communities, and the language says, provided, however, that no place of living, facility, or other entity shall use the term assisted living care or assisted living community unless it's licensed pursuant to Section 31.7.12.2. That's the new category. That's the new section. We're not trying to advertise that. We're trying to advertise as assisted living, which everybody knows is those 24-hour oversight, the activities of daily living, so we're not trying to change the scope, and we're not trying to open it up to provide more. We're not trying to water down the current category. We're not trying to provide new services. We're wanting to do exactly what they've been doing and what they said. Finally, I want to thank you. This has been a long hearing. I think this is a very conservative approach. But this is a very significant issue, and if you can't support this conservative approach, I would urge you to help us find a middle ground, because the department has given till May 1st on this, and we need to work this out. Thank you very much.
Any questions? Mr. Bauer? Thank you, sir. John Howell.
Thank you, Mr. Chairman, members of the committee. I'm John Howell with the Georgia Healthcare Association. We represent 342 skilled nursing facilities, a growing number of what are now licensed as personal care homes, and 20,000 patients now being served in the community through the SOURCE program. We have a tremendous amount of respect for the author and the co-signers and what they're trying to accomplish here today, but we felt compelled to let you know our concerns. We were a part of the debate, the ongoing debate that went on for some 16 years, and felt like we had a bill that all could be relatively happy with. There were a couple of points that I wanted to try to clear up. One has been made about the lack of licensure of this new category, the 2,200 eligible personal care homes, that only 6 have been licensed as assisted living communities. A couple of points there. There are, I think, as Walter pointed out, almost 270 that are over this 25-bed threshold that will be eligible to apply. They have not finalized that application process because the life safety codes dealing with the ability to sprinkler buildings. We've heard about 13 and 13R sprinkler systems. Unfortunately, for those of us that live in this world, we know more about that now than we probably ever wanted to. But I can tell you there's a clear delineation in the bill, stated numerous times. And it may not have been the intent of those that read the bill that have testified today, but I can tell you that it was the intent to make it clear to the consumer that a personal care home is this level, up from that is an assisted living community, and then, of course, the skilled component at the top. So wanted to be sure that you understood that was certainly was our intent to make it clear for the consumer, and anything that made that confusing, we certainly wouldn't be in support of. So, Mr. Chair, I'll pause for any questions and see if there's anything we can offer.
Any questions for Mr. Howell? I guess you've done a good job there. Mr. Maxwell, Representative Maxwell. We'll allow you the last words here.
I agree that the Senate Bill 178 don't have a problem with the protection of the terms assisted living community or assisted living care. It never was the intent of the people with the personal care homes when this legislation was coming through. Matter of fact, if they had known that this was going to be a direct change to their marketing strategies, what they did, they would have not signed on to this bill at that time. I firmly believe that. A couple of points I'd like to make. First thing I'd like to share with you a letter I got from a friend of mine back home. His stationery, his heading is Kimberly Assisted Living Care. Thank you for taking time to share my concerns. I'm the owner of a 32-bed assisted living home in Dallas, Georgia. In 1988, we applied and received a personal care home permit in the state of Georgia. Been operating on these guidelines for the past 15 years. When using the name assisted living home, we thought it best described who we are and what we do. We provide 24-hour oversight, all the things that have just been talked about, limited assistance medication, amputation activities of daily living, eating, bathing, toileting, grooming, dressing. As a matter of fact, our motto has been providing assistance while encouraging independence. So this has come as a surprise to us. We will no longer be able to use the term assisted living in our facility name or any of our marketing material. Further, it's going to cause a financial burden, but more importantly, it's going to confuse the people in our community. It appears to me they talk about the people out in the communities, out in these different areas where these 2,203 homes are operating. Those people understand pretty well what they're doing. I think the confusion rests with a lot of people in this room here when we come up with these ideas of the assisted living community and assisted living care. They can advertise that all they want. All we're asking is we not go out here and let 6 people, 6 organizations that have come in here and set up under the assisted living communities or assisted living care, let them dictate to the other 2,000 or so folks that have been doing this for a number of years that they've got to now go back and change their marketing, their advertising, their branding, and everything they've done. The answer, you got your answer, I think, between the difference between the higher level of care in assisted living communities and the personal care homes. The level of care, nurses that have to be on staff, the fire protection that a lot of people don't qualify for. So there's a little higher level of skill required in the assisted living communities. We don't have a problem with them using their names. We're trying to protect the guys who've been doing this job for years. 2,203 of them. If there's 200 of them apply to go into the assisted care community nomenclature, that's fine. We're still going to leave 1,800 folks out here that's going to have to change their name and change their marketing plan. So I would ask you guys to let us move this forward. Assisted living has been stated is currently the pervasive term that's used in over 40 states now. People know what assisted living is. When they call and come into the community, they know what place they need to go to get the proper care for their loved ones. So I'd ask you to help me move this bill forward, and I'll try to answer any questions.
Any further questions for Chairman Maxwell? Okay, thank you, sir.
Thank y'all.
Representative Kirby.
Thank you, Mr. Chairman. Senate Bill 178 obviously caused us a mess here with two words, assisted living. Just that simple. There's a lot of confusion out there about this. Matter of fact, before I started doing the research on this for this hearing, if you would have asked me, I would have told you assisted living is the lowest level, and then personal care is above that. You know, I consider my mom and dad living at home getting assisted living care because they come by with the oxygen and different things, and the gal checks on them every week, make sure they're okay. Those are terms we've used in this industry for a long time of what, and everybody kind of knows what, you know, somebody said everybody knows what that means. Well, everybody knows what it means to them. And before we, and I agree with the chairman, it's not fair to people who've been marketing for 15, 20 years what assisted living means or is in their facility. I think that what we should do before we continue to compound a mess is let's ask the industry to come up with 3 licensure names. None of them contain the words assisted living. I prefer them not to be just level 1, level 2, and level 3. I think there should be some cause to it. But if we have 3 names for the 3 levels of licenses we have, and none of them can contain assisted living, because a skilled nursing home is certainly assisted living to the extreme level, and everybody can use, if they want to continue to market assisted living, that's fine. Their license level doesn't have to be this, you know, wouldn't be the same as their marketing level. The rules are in place, are already applied. Now, originally I was thinking earlier today, after in talking to some people, that we couldn't do this until next session. We've got a week really before scheduled. Week from today's day 29. I would think some qualified people can come up with 3 names that don't include assisted living in a week's time, and clear this up a little bit easier than having something that may or may not apply. So I would like to suggest that we hold off and see if we could get something done on that level before we move on this bill.
Okay, thank you. All right. Any other members of the committee that have a comment they'd like to make before I ask for the will of the committee?
I can concur with Representative Kirby, because I think that we do need some clarification of the 3 levels, and I would like to also see it written out in plainer terminology so that the 3 levels can be distinguished clearly for all citizens.
Number 5.
I'm sorry.
I couldn't see who it was.
It's all right. Thank you, Mr. Chairman. I concur with the 2 representatives before me, because even though I've worked training people in this area, I have some serious problems. So my 40 years of training won't even help with this when you're dealing with people who don't have a clue. And since I'm in the largest population you're going to be taking care of, help me. Just help me. Thank you.
All right. Any other comments? What is the will of the committee? Number 12.
I guess I make a motion we table this for now.
All right. Motion to table carries precedent over everything else. So, do I have a second? Okay, we have a motion and a second. Any other comments before we vote on this? Motion to table would mean that we would come back at a time to be set by me, I guess, to determine what the will of the committee is. And so we have a motion and a second to table. There being no further comments, we'll take a vote. All those in favor of tabling House Bill 398 to a time later to be set by the chair, all those in favor of that motion, if you would, raise your hand. All, if you got all those opposed, if you would, raise your hand. All right, what was the yes vote? The motion carries. The bill is tabled until further meeting. There being no further business to come before the committee today, the meeting is adjourned.